So Isabella, to tailor in on this, let's come to your perspective from being the CEO of Infinity Health and just talk about women working in healthcare and just how that entire profession is female dominated and the impact of that with, let's say, the system not being quite modern, possibly antiquated.
Yeah, so traditionally speaking, for decades and decades, the frontline workers are primarily women, and then in upper leadership, you see a lot of men, right? So that's been a question that a lot of us in nursing have always thought about and talked about, and still, I mean, there's a pretty big difference there too. But I want to kind of go back to what Carmen and Sandy said about being your own advocates. A lot of people don't know that physicians, when they see you, they're private healthcare and they bill the primary care network. So if there's a physician that you have and don't like them, fire them and find somebody else that can do it, because they want as many clients as they can get, and they bill the primary care network. And a lot of us women don't even understand that there are options for you. So fire the physician, call 811, and they'll give you 3 other doctors that are seeing new patients. It's so important, because it could potentially save your life. And if you have a doctor that doesn't really listen to your symptoms and kind of disregards you, that's a big deal. And they have a vested interest to provide the best care and ask the right questions. But women think that they have to go with this. And I'm really passionate about it, because I've seen so many people go down into horrible diagnoses later on, but it could have been fixed many years prior.
Absolutely. And an example that Jessica from our audience brought up, she says, I appreciate these examples. I have had a string of health issues and symptoms this past year and was not getting anywhere with a male GP. Last month, I finally got in with a female GP, and she immediately took my concerns seriously and set up a host of diagnostic testing. I believe having a female GP is key to my concerns being validated. So exactly that advocacy and standing up for yourself and making sure that you find someone that's going to consider what's going on, not just...
It's funny. I had Dr. Tankel delivering my first daughter, and he's like, I know how this feels. No, you don't. But yeah.
So I want to build on this conversation a bit.
Yeah.
I don't want anybody who's listening in today to think that there is a huge difference between male and female doctors. I think there is a huge difference between knowledge, skills, passion, empathy between all doctors. And so there are a lot of women that would actually prefer a male doctor, but they need to have access to a male doctor that is open-minded and patient-centered and willing to listen. So I know also that some women feel far better when they have a female practitioner. And I keep using the word practitioner. In Alberta, the system is changing, and a practitioner doesn't necessarily just have to be your doctor. Your pharmacist is available to you and has a huge scope of practice in order to provide clinical supports, and has the time to have conversations with you that could maybe help you triage your system and then have a better experience when you go to the doctor. So Isabella is 100% correct when she's talking about being your own self-advocate. But you need to do that with authority and information and navigate the whole system. If you're having pelvic issues, you can go to a physiotherapist. A lot of people don't even realize that. And so there's lots of opportunities there. And Isabella is right that if you're not satisfied with where you are, put all your information together, understand what your experience is, talk to some experts with any of the patient associations that would be dealing with your situation, and then attack it. Attack your health experience and own it, and then you can push through it. It won't always be easy, but you can.
I think you just inadvertently answered a question that we got from the audience about recommendations for navigating the health care system in a time where the access to resources or access to a doctor might not be as easy. So thank you guys for just taking that on immediately.
Can I add one more little thing? To being your own advocate, but also having a network around you. We all probably have somebody in our lives that are within the healthcare system in some way, shape, or form. And it's asking those questions to those individuals instead of going on Google or having it really impersonal. Ask people that are in the healthcare system. They're there to help, and they've gone through years and years of schooling to understand the healthcare system. So having that that support network behind you would be great.
Absolutely.
Thank you.
I want to ask Sandy a question, and I'm asking this because this has come up in other countries. It was even bandied around a little bit in Canada, and it was about menstrual leave. And that has a huge impact on the workplace, stigma, gender, culture, and bias within workplaces. And in other countries, right now, there is legislation in place that allows women, employees, to have 2 days per month of menstrual leave that is not a part of their other leave, that their sick time or holidays or anything else, but it's just 2 extra days per month for menstrual leave. I want to know what you think about that, Sandy, because there's mixed feelings on this, pros and cons and risks.
Right. In Canada, I don't think we have that today. At least I've not heard of it. But I know in Europe, probably I would think, Austria, countries like Norway and whatnot too, they're very progressive that way. I think it'd be great. I mean, I'm going to be pro and con. So it'd be great to be able to have that. So if you did need to trigger a day, to be able to use as, let's say, part of that benefit, that'd be wonderful. But I also will put the con on there too, that risk around that stereotyping, right? Because here you off again, Karma's on another holiday apparently, and menstrual cycles, right? So there's a lot of that stigmatism that still exists, but I think it's, if you've got bigger companies are probably better at it, though, I would say, because they tend to have a much more, even with diversity and inclusion. I was at International Women's Day and heard 3 different experiences. From one was somebody from the Indigenous, community, another was a transgendered, and one from a newcomer, and them having to navigate, their corporate environment. And I think larger companies are better for that, where they wouldn't have as much maybe stigmatism. There's a lot more flexibility around policy and health, sort of initiatives. With smaller companies, especially mom and pop shops or private companies, I don't think you'd be able to get away with that. There'd be a lot of judgment there. They probably want to terminate you after maybe the 3 months, if you had to maybe trigger it in 2-month installments or whatever, where they would just view you as being kind of weak, or, here you are another day you want to kind of take to be able to go read a book or go shopping, right? So there's unfortunately that bias.
Okay. So can we expand on that then? And instead of just sitting here complaining about things being rough, Sandy, what do you recommend that we do to help improve workplace equity and combat the bias against women in the workplace who might need to do things such as take time for healthcare or menstrual leave or things like that, should it ever come here?
So I think if you're looking for work, the big thing is making sure that when you join an organization, that culture really fits, who you are and what you kind of represent, right? So if you're looking for an environment where it's got a lot more flexibility and a lot more kind of oversight, again, then that's a better fit. But sometimes you don't have that option. But if you're working for an organization that's more of a blue collar, or again, you talk about trades, Carmen, too, as well, and don't have that ability, I think it'd be great to be able to see if there is an HR, department or whatnot, to setting up a bit of an initiative around, maybe it's International Women's Day or some type of women's coalition or women's support, just to be able to provide a bit more equity in the workplace, right, for initiatives like that. But I think it's still hard because it's more still a male dominant world in some of these environments, right, where it is really hard. But I think getting involved and having more of a larger voice and maybe like educate where, let's say if you need to be able to take a day off for a menstrual leave, right? I mean, you have to have a doctor's note to verify, right, that you actually are, that is that time of the month, right? So stuff like that too, which is kind of crazy, but they're baby steps. But I think from an awareness perspective, from an advocacy perspective, we are kind of making a bit of grounds, but I think there's still a long ways to go.
So I want to say, to your point, Sandy, the other reality is of addressing the gender inequities is get to the root cause.
Right.
Disruptive menstrual health conditions are treatable. So they don't even have to enter. They don't even have to be a factor in the workplace if the women hadn't been dismissed for up to, or even more than 10 years. They could have dealt with those conditions and then it wouldn't even be an issue. So it's kind of a chicken and egg thing. And, maybe that's another consideration, is that employee assistance programs need to have better resources about gynecological health conditions and musculoskeletal conditions, the things that are keeping women at home more than, or taking more sick time than what is productive in the workplace. There's other ways to get to the root cause than just putting better policies in to allow them more time off.
Thank you, Carmen. That's a really good point.
And just going through that, just to do a quick little tie-in, our next event in April is going to be around more women in the workplace. And I know we've got some examples lined up of what happens when you speak out and how to deal with that, because that is definitely something. And I know there's a little bit of stigma potentially around, putting your hand up and saying, hey, like, where's my bathroom? Right. Or just, being disruptive.
And I'll actually mention too that whenever women when we convert them from one company to another, they were so scared to tell their doctors or their nurses, I don't like how you're doing this, you're not listening to me. They were so scared that if they did, they wouldn't get this. So there is that fear that I've seen very often.
Well, and let's expand on that a little bit, Isabella. A going theme throughout this conversation is about being a self-advocate. And one of the questions that we got was how to explore the resources that are available, and how can you deal with it if you're going to someone and you're like, I have this pain and it's intense, and they're like, did you take Midol? Right? How do you deal with it in this situation? And how do you make sure that you're exploring all of the resources that are available to you?
Great question. It's going to be very hard to do, because if you're in a doctor's office and you're being dismissed, you could ask for a second opinion from another doctor there, but you'll have to put that foot forward first and say, no, I'm not leaving, something's wrong. Or sadly, go into those Medi centers. Some Medi centers are really great. And if you're not getting what you want from your doctor, you can walk in and say, hey, I'm in pain. And they'll have a list of everything that is going on with you, look at your symptoms. But they also have access to Netcare, so they can actually have a look of what has been going on.
So I'd like to add to what Isabella's saying, that it's that whole, I use the line, take authority of your health experience. Knowing, so every patient association, so as per my bio, I've worked in arthritis and diabetes and MS and seniors and disabilities and now women's health. And then I also worked in anaphylaxis and cardiovascular when I was with pharma. So, but one of the common things that's in all of those patient associations is that they want to empower the patient. They want the patient's voice to be strong, informed, and influential. And almost every one of them on their website will have a checklist that says, these are the questions. Ask them for yourself before you go in, and then bring the things that are holding you back the most to the attention of your doctor. So go in and be an informed patient. And I tell women who are dealing with gynecological health issues, if the doctor's first question is, how old are you? Say to him or her, you don't get to ask me that. First off, they can look in the file, so they already know the answer to that. But secondly, that's not where they get to start the conversation with you. And I think doctors sometimes just need to be reminded to take a pause and refocus on the patient. And if the patient engages with an unexpected behavior from the 10 other patients that came in before, then they will have a different experience with that doctor, even one that normally doesn't slow down enough to have that good conversation. And I can tell you again, very personal experience. This happened to me, and it happened with a gynecologist. And this gynecologist is now still my gynecologist 20 years later, but she started off in a hurry and I slowed her down. I said, this is not the conversation we're going to have. And if you go on her MD file, it says she's abrupt and, various things. But it's part of that is the patient's fault. And so be an informed patient. And like I said, use your pharmacist as your guidepost, as your informant. If you have menopause, there's way more nurse practitioners. Nurse practitioners know more about menopause than most family physicians. And so, because they're training specifically in that discipline. So go to the patient association. I get calls every day saying, who can I talk to? I can't necessarily say who to talk to, but I can tell who all the practitioners are that are serving gynecological health. And the Arthritis Society can tell you all the family physicians who are specializing in arthritis or cardiovascular, or, so go to the patient association. They're the ones that give you a voice and can help you navigate.
Isabella, you look like you've got something to add there.
Oh man, I could probably talk about this for a long, long time. But you know what? Being an advocate is a really hard thing to do. I've just become comfortable doing it. So it's not easy. It never will be. But I just want people to know if they're getting really terrible care or anything like that, they always have options. Always, always, always. And if they don't know, call 811 or somebody in your network that is in healthcare. Because the last thing that you want to do is go on Google and start researching things that, there's vast amounts
of cancer.
Yeah.
Cancer. WebMD, it's cancer, you're dying.
Yeah.
So Jody, the other important thing to remember is that 68% of women right now today do not have a regular healthcare provider. So what do women who don't have a healthcare provider do? One is exactly as Isabella said, find your walk-in clinic or your Medi Center and just keep visiting them until you find the doctor you like. And then when you find a doctor you like, whenever you have a situation, go back when that doctor is scheduled to be there. And when that doctor goes to another clinic for whatever reason, find out where they go. It's a little bit hard to track family doctors these days because they do move around a little bit. But if you find somebody you worked well with, they don't have to be in a regular, neighborhood clinic or your PCN or whatever the case may be. As Isabella said, the practitioners are out there. Don't stop looking until you find the one that you can relate to. And walk-in clinics have some really great practitioners. And primary care networks, their multidisciplinary approach will help to navigate referrals in a more timely way, more appropriate diagnostics. The nurses and nurse practitioners in PCNs are so incredibly smart that you only need 5 minutes with the doctor because you've got to spend 30 minutes with the triage team in a PCN. So find out what's in your neighborhood. Just walk in. Seriously, just even if it's not a walk-in clinic, walk in and talk to that nurse at the front desk.
One story very quickly. My family doctor moved on to a different role, and she had a locum doctor come in that was seeing patients just while she was off for a little bit of time. And she gave my mother-in-law a prescription and said, I need you to book a follow-up with me. And during that window of you need to book a follow-up with me, our doctor finished her term and moved on and had brought in the replacement. My mother-in-law, instead of saying, okay, well, I was seeing this doctor and then I saw the locum doctor and now I'm going to bounce to the new one, said, no, I liked this doctor. I'm going to stick with her. She had gotten the doctor's contact information and called the office. And the office was like, no, I'm sorry, we're not taking on new patients. And so speaking up for herself, she said, no, I saw this doctor. She told me that I needed to book a follow-up with her. So I need you to book me an appointment with her so I can follow through on her instructions.
I'm scared of you right now.
So and well, she's scarier than I am, trust me. But a little bit of that, a lot of the treatment that we get just is based on what we will accept. Will we continue to accept being dismissed? Will we continue to accept people telling us no or things like that? So the more we can stand up and say, slow down,
Yeah.
I have shoulder pain, date of my last menstrual period doesn't really matter here, right? Those are important conversations to have.
Well, I have a story in high level. One of the, she was a 16-year-old girl. She was raped and was pregnant. And the locum that was there at the clinic, he says he doesn't believe in that. You have to have the baby. So it's awful, but there was no other doctor for like 8 hours anywhere. So completely dismissed her and didn't even offer any mental health support. So it's happening everywhere.
Okay. Well, so we do have a couple questions and I want to come to them just for what we haven't addressed, but I do want to end with a little bit of hope and a little bit of a conversation around the action that we can take, right? Because we are not coming together just to have the noontime version of, pardon my language, a stitch and bitch, right? We know that we can create change by doing things and coming together, joining organizations like BPW that have an advocacy component. So I'm going to pose this last question to the panel. What are some of the tangible things that we can do to challenge the inequities facing women in healthcare, and what can we do as an organization and individually to deal with this? And Sandy, you've spoken probably the least today, so I'm going to come to you first, then I'm going to go to Isabella, and I'm going to end with Carmen.
Thank you. I think still being able to, especially in the workplace, if I can bring that sort of lens back, is making sure that there are sort of, for diversity and inclusion, that there is sort of women representation or somebody you can kind of talk to for sort of issues like this, whether it's around healthcare or whatnot too, that you need access to, making sure that you've got maybe health support as well through work, right? In terms of whether it's your extended health or different policies and whatnot to do. But I think still as a leader, again, advocating for more people within your organization, right? To, like Carmen had mentioned and Isabella too as well, I think having a voice and being comfortable with your voice. And you can do it in a really good way where it's educating and it's more awareness, versus, kind of the other side of the lens where it's more about from a negativity perspective, kind of always kind of bitching or stuff like that. So I think having that voice, being comfortable to be able to, speak up and also always put that lens in around, let's say, if there is any stereotyping around the organization too, framing it around, okay, so why am I sort of receiving some of the stereotyping? Because if, Joe Smith was going to take 3 days off, due to something like that too, a health concern or stomach, virus or whatnot too, why is he not sort of being, sort of tainted the same way as I am? So I think still having that voice around advocacy and being, again, having more confidence to speak up. And if there's somebody in your organization you can go to as a safe place to be able to say, hey, do I have your permission to be able to, as a safe place to be able to be very honest and real with you and then address your issue, right?
So, thank you so much.
I mimic what Sandy did. It's bringing up yourself to get that courage to stand up for yourself. I think any of us that have children, if something happens with them, mama bear comes out, right? But when it's actually you, I feel like in the past I've dismissed my symptoms because I know I love myself, but it's more about the family and keeping everybody healthy. So I think that bringing up that courage to start that conversation, kind of like Belle did around mental health. Let's start a conversation, right? Exactly. Little stuff like that. Start talking to one another.
So do you want me to go next?
I do, yes.
I'm going to take a different direction because I think Sandy and Isabella have done a really good job about how it's so important to start a conversation and stand up for yourself. I'm going to talk specifically about policy. Policy is complex, and you have to really understand where it's viable to even consider asking for a change. And because we're talking about health is a very antiquated, huge, massive machine that is very comfortable in the way it has been operating for over, for hundreds of years. And it's also very patriarchal, and it's tied to compensation. So if you do anything that might challenge or threaten somebody's income or security, then you've got a lot of people pushing against what you might be asking for in terms of change. So policy is very, very complex. Changing old policy is much harder than influencing new policy that's going to come out. So that's always one tip I give people. So if you're looking at gender inequities in health, look at the things they're talking about for the future and influence them before decisions are made. But nothing can change without evidence. And a part of the problem with gender inequities in health is that there isn't much data. Just as we said, women aren't included in research. The billing codes, for instance, don't differentiate between male or female submissions unless the condition is specific. Are no men getting pap smears. So yes, you can count pap smears and say that that's for women, but if you looked at cardiovascular billing codes, it wouldn't tell you the real story about what's happening with women in cardiovascular. So there needs to be a push now and going forward on better evidence and data with respect to gender equities. You can go through health, or you could, at least federally, we can go through wage and gender equity, because they still have a status of women department. Alberta eliminated that. It's one of the election challenges the Women's Health Coalition will be putting forward, is that either the status of women needs to be reinstated, or they need to put in legislation like the gender-based assessment plus that the feds have, so that when new policy, new legislation, new regs or budgets are being assigned, that they consider whether or not they are fair to women, whether or not they have considered impacts on women, and will support women as the people who are supporting communities, families, and workplaces. And so it's way easier to influence policies before they're made. And it takes 10 years or more to change an existing policy, and I'm not making that up. It took over 10 years to get seeing eye dog legislation put in place federally. And what could make more sense than that? But it was because there were dog fights, let's use that word. There were dog fights about who was going to get to do the training, and who was going to certify the dogs, and who was going to pay for the dogs, and whether or not that was preferential to people who were blind versus people who had physical disabilities. And so over 10 years it took to get that legislation. So if you're tackling existing policy and it's been entrenched for a long time and there's a lot of systems around it, that is going to be like pushing a rope uphill. But if you look at your opportunities for new legislation, campaign promises, all of that kind of thing, that's where you can influence things that are coming into the pipeline. So perfect. That's where I'd like to finish.
Thank you so much. And again, thank you to our amazing panel. I could not love you guys more. And I think if there was a takeaway for this, just in terms of that advocacy piece, just like to remind people that you can't fix a secret. And with that, I am going to pass it back to Angela to close things off for us.
Thanks, Jody. Thanks for your excellent moderating. And of course, thank you to Carmen, Isabella, and Sandy for all of your amazing wisdom. I was trying to decide what my takeaway for today would be. And I think that it's a combination of really focusing on the evidence of what's actually happening and using information to create change. But I'm a very pragmatic person, and I have a list of things that people can do today to help you with yourself or share with your loved ones. So the first one is fire your doctor, call 811 and ask for who's taking new patients. Leverage your patient association. That list of questions to ask, this is the thing that I have trouble with, this advocacy piece. And I think it's why we had the question in the chat about policy, is like, I'm a pretty good advocate for myself. I know what to ask, I can read, but that notion of having a list of questions to ask for somebody to start with if they don't know where to start or what to say, I think that was a really practical tip. The other one is use your pharmacist as another expert. I think that sometimes we think that doctors know all the things, and they don't. Doctors have certain training in certain areas. So you have a pharmacist you can lean on. There are other health practitioners you can lean on too. Well, I thought this one was interesting too. Walk in, even if it's not a walk-in clinic. So like, yeah, walk in, talk to the nurse, see what they're like, get a feel for it. And I like what you said at the end, Carmen, about policy, and it is complex and it is difficult, but I think these baby steps we take by having conversations and sharing information are what we can do. So before I let anyone go, I'd like to give one more reminder about our next Learning and Advocacy Mixer, which is on Wednesday, April 26th from 5 to 7 at the Common on 109th Street here in downtown Edmonton. We try our best to book women-owned venues, and this one is no different. So the event is open to members and non-members alike for $30 or $35 respectively. So you get an event, you get your mixer and your information sharing, and you also get some food and drinks that go with that as well. I think that Jill's going to post that. No, we don't have the link for that event yet. Please stay tuned to our social media on LinkedIn if you don't follow us, or our website for information on that event on April 26th once again. And as a note, anyone who signs up for membership now will have access to member benefits for the rest of the year, this year and next. So if you attend our April event, you'll also receive a special member gift bag worth over $200. So that's an exciting opportunity. So if you're coming to the Common on the 26th, that will be there for you as well. It's important to remember that membership fees for BPW Edmonton primarily go towards our partnerships with BPW Canada, and they secure our seat at the table to ensure we can continue our advocacy work, including our consultative status with the United Nations. So if you're thinking about whether or not this is worth it for you as a membership opportunity, please keep that in mind. So once again, thanks to all of our panelists, to Jody for moderating, and to Jill for her amazing tech hosting and organizing abilities of this event. And of course, to all of you, thank you for joining the discussion that will create positive change for all of us. See you next week.